See how we do.
This meeting is being recorded for minute-taking purposes, as well as for posting of the recording of the proceedings on the agency's website. This meeting is also being live streamed on the Access Health CT website. Thank you, Mr. Chair.
Thank you. Let's do the attendance. This is Charles Klippel, present.
Thank you, Mr. Chair. Paul Philpott, Vice Chair.
Here.
Thank you. Grant Ritter.
Here.
Thank you. Deidre Gifford. Steven Hernandez. Let me just see who's joining. Okay, Steven Hernandez. Matthew Brockman. Thomas McNeil.
Present.
Thank you. Dina Berlin.
Yep.
Thank you. Andrea Barton Reeves, DSS Commissioner. Kathleen Holt from OHA.
I'm here. Thank you.
Thank you. Zani Imatovsky on behalf of Secretary Jeffrey Beckham from OPM.
I'm here.
Thank you. Paul Lombardo from Connecticut Insurance Department. Dr. Manisha Jutani, DPH Commissioner. And Caroline Zambetti, a designee for Nancy Navarrete, DMS Commissioner.
Good morning, I'm here.
Good morning, thank you.
Good morning, Marcia. I'm back. I had to take a call. I apologize, but I'm here.
Thank you, Commissioner. Appreciate it.
Good morning, all. And Marsden, keep an eye out for anybody that joins us during the meeting. You have switched up the agenda here, so we're going to start with James. Without further ado, James, the floor is yours.
Mr. Chair, I think on the annotated agenda, I think the senior leadership team will introduce themselves.
Oh, I'm sorry. Forgive me. Yes, please. If you could, the leadership team of the exchange, please. James.
So, thank you. Good morning, all. James Michelle, Access Health Connecticut.
Gina Walsh, Director of Operations, Access Health CT.
Holly Zwick, Director of Finance, Access Health CT.
Rebecca McClear, Director of Technology and Operations and Analytics, Access Health CT.
Susan Rich-By, Director of Legal and Governmental Affairs, Access Health CT.
Roulette, Director of Marketing, Access Health CT.
John Carbone, Director of Small Group Product Development and Broker Support, Access Health CT.
Good morning, this is Glenn Jurgen, Director of Human Resources, Access Health CT.
Good morning, Tammy Hendricks, Director of Health Equity and Outreach, Access Health CT.
Thank you all. I appreciate it. Have I missed anyone?
No, we're good, Charlie.
All right, sorry. We have no public comments, I understand. If that's true, Marcin, then I think I will go to James for his introduction.
That is true, Mr. Chair.
Thank you very much. Very quickly, good morning, all. I'm James Michelle, the CEO of Access Health Connecticut. Thank you all for being here this morning. Before we begin, I wanted to share an update on our communication efforts regarding the potential expiration of the enhanced subsidies at the end of this year. As you know, these enhanced subsidies play a big role in making health coverage affordable for many of our customers and their families. Our advertorial regarding the importance of keeping these subsidies recently ran in 19 publications across the state of Connecticut. I have received personally a lot of positive feedback regarding our message. We have met with Governor Lamont and the state legislatures to discuss the significant impact the loss of these subsidies would have on our state residents. We have also met with the major hospitals and the insurance carriers in the state. We are all aligned with the same message and are moving forward. We will continue to do all we can to raise awareness about this issue until it is addressed by Congress this year. I also wanted to mention that I shared a summary of the last open enrollment with the board. This was a record-breaking open enrollment period for Access Health Connecticut. More than 151 customers enrolled in plans through Access Health. That includes more than 41,000 residents enrolled in the Cover Connecticut program. I think we have exceeded 42,000 at this point. This year's enrollment exceeded last year's record enrollment by 17%. It is important to note that the enhanced subsidies play an important part in these enrollment numbers. Please reach out to me if you have any questions regarding the report that I sent out last week. Today's agenda is brief. First, we will have a membership update for a number of committees. I want to extend my personal thanks on behalf of the board and the chair to those who have served on these committees and are now leaving us. And we welcome our new committee members. Next, we will review the qualified health plan certification requirements for plan year 2026. Yes, we are talking about 2026. The Health Plan Benefit and Qualification Advisory Committee has been meeting since January, and the committee's recommendations will be presented to the board this morning for your consideration. Thank you very much. If you have any questions, please let me know. Thank you, Mr. Chair.
Thanks, James. Any questions? If not, then we will. I would ask for a motion to ask for any discussion on the minutes of the last meeting. If no discussion, I would ask for a motion to accept the minutes of the last meeting.
Hi, this is Grant. Motion to accept the minutes.
Thank you, Grant. Second.
Seconded, Tom McNeil.
Thank you, Tom. Any further discussion? If not, then this is Charles Klippel. Yes.
Thank you. Paul Philpott.
Yes.
Ron Ritter.
Yes.
DJ Gifford. Stephen Hernandez. Matthew Brockman. Thomas McNeil.
Yes.
Thank you. Dina Berlin.
Yes.
NJ Barton Reeves. Commissioner Reeves. Kathleen Holt.
Yes.
And Zani Matowski.
I abstain.
Okay. Thank you.
Thanks very much. I'm sorry, John Carbone, do you have a question? If not, then Susan, I believe the floor is yours to talk a little bit about committee membership.
Thank you very much, Mr. Chair. We have a vote today. As James mentioned, we have some changes on some of our committees, and the exchanges bylaws require that the board approve new members to committees and also members stepping off committees. So we have some changes, I believe, on the advisory committees, and I think maybe one of the standing committees. So that is what we have before you today. Thank you.
Okay, Marcin, I'm going to let you read the vote so that I don't get it wrong.
Yes, Mr. Chair. Chair Charles Klippel will request a motion to remove Leslie Greer and Giselle Carlotta McDonald from the Health Equity Outreach and Consumer Experience Advisory Committee, to remove Brandon Riff from the Health Plan Benefits and Qualifications Advisory Committee, and to appoint Jacqueline Sanchez, Maria Santos, and Elisa Neira to the Health Equity Outreach and Consumer Experience Advisory Committee. Is there a motion to approve?
Marcin, just before we do, am I correct in assuming these people are either term limited or have asked to be replaced on this committee?
Yes, they have asked to resign and to have that resignation approved by the board.
Thank you.
And Charlie, they've asked for a variety of personal reasons.
Yeah.
They've been very good contributors to the committees. They just have conflicts in their own personal lives, professional lives.
Understood. All right, thank you. And
Hi, this is Grant. Motion to approve this motion. Motion to approve
Second,
this.
Tom McNeil, second the motion.
thank you. Any further discussion? If not, then Charles Klippel, yes.
Thank you. Paul Philpott,
Yes.
Grant Rader,
Yes.
DJ Gifford, Stephen Hernandez, Matthew Brockman, Thomas McNeil.
Yes.
Thank you. Dina Berlin.
Yes.
Thank you. Andrew Barton Reeves. Commissioner Reeves. Kathleen Holt
Yes.
and Zani Matovsky.
Yes.
Thank you.
All right, now that we get to, I think, the meat of this particular meeting, and thank you all, and thank you to the members who have served in those committees. To talk about qualified health plan certifications for the 2026 plan year. Kelly, I'm going to ask you and Julie to lead us through this.
Great. Thank you, Mr. Chairman. Good morning to everyone. My name is Kelly Cody. I'm the manager of plan management for Access Health CT. And I will be presenting along with Julie Andrews from Wakely Consulting the 2026 standardized plan design recommendations for both the QHP and the SADP products as recommended by the Health Plans and Benefit Qualification Advisory Committee. And if nobody is concerned, I'm going to shorten that to HPBQ. That's a mouthful. As many of you are aware, the members of the HPBQ Advisory Committee represent a variety of backgrounds and interests. We have community healthcare advocates. We have an individual from the Connecticut Hospital Association and representation from each carrier. We also have a member from DPH and from the Connecticut Insurance Department offering their expertise along with members from this board. This diverse membership provides Access Health CT with meaningful input for the challenge of making plan design changes, which will have a positive impact on our consumers. The main objective is to provide benefit recommendations for the standardized plans and that meet both the federal and state requirements while continuing to offer quality healthcare options for the residents of Connecticut. Before we get into the heart of this discussion, I'd like to take a few minutes to provide a quick overview of the certification workflow and timeline. Existing and potential issuers are advised of the Access Health CT certification requirements through the QHP and SADP issuer solicitations, excuse me, each year. These documents provide a summarized outline of Access Health CT and federal requirements, as well as providing the standardized plan designs, which we are about to discuss. Based on that guidance, any issuer that forwards a completed notice of intent to participate on the exchange will then receive an issuer application. All issuer applications are due back to Access Health Connecticut on the same date the rates and form filings are due to the Connecticut Insurance Department, and for this year is June 1st. To provide issuers enough time to respond to the application, Access Health CT targets the release of both the QHP and the SADP solicitations shortly after receiving the Board of Directors approval of the HPBQ Advisory Committee plan recommendations. Today, we are seeking board approval for those recommendations from the HPBQ Advisory Committee on the standardized QHP and SADP plans for plan year 2026. Just a note before we begin, we have received the final federal guidance for the maximum amount of pocket and the actuarial value calculator for 2026. However, the IRS regulations relating to high deductible health plans has not been finalized. Additionally, state legislation sessions end in early June. Given our need to move forward, we will be presenting information based on what we know today. And if any of the proposed plans are later determined to be out of compliance with the federal guidance, we may need to come back to this board for further consideration. So with that said, in December, Access Health CT, Wakely Consulting, and the issuers began the process of reviewing the 2025 standardized health plans in the final 2026 actuarial value calculator. This evaluation is the starting point each year for the standardized plan design development process. CMS sets the de minimis actuarial value ranges for the plans, and in a separate evaluation, the issuers must also test for compliance with the federal mental health parity requirements. During the initial review of the results, we learned that many of the standard plans would require changes in order to be compliant. Julie Andrews from Wakely Consulting worked closely with each issuer, providing multiple plan options for evaluation and eventually developing compliant plans across all issuers. The committee met multiple times, continuing thoughtful conversations, providing suggestions for plan design enhancements, and ultimately the final plan recommendations that will be presented today. For the standalone dental plans, or the SADPs, there is only one standardized plan and the de minimis ranges do not apply. However, each year CMS does communicate the annual maximum out-of-pocket amount based on the U.S. Department of Labor Statistics Consumer Price Index, which is specific to dental services. This is the area of focus for the committee, and I will go into further details at a later point during this presentation. Martin, if you could forward to the next slide. Thank you. So Julie is going to go over the regulatory variables related to CMS and IRS, but here I wanted to mention that the enhanced subsidies remain available through plan year 2025. Access Health CT is actively monitoring and communicating with various stakeholders and the public about the need for Congress to extend those subsidies for consumers. On the state front, we're currently not aware of any state legislation changes that would have impact directly to the plan designs for the upcoming year. However, until the legislative session ends in June, we'll continue to watch for any new or impactful legislation. Next slide, please. This is our plan mix for the individual and small group medical and dental plans offered through the exchange. For both qualified health plans and standalone dental plans, this slide outlines the number of plans by type that a carrier is required to submit, as well as the number of optional plans they may submit for certification. For the individual market, Access Health requires that each carrier submit 4 standardized plans, but allows each carrier to submit an additional 9 non-standard plans, which totals to a maximum of 13 plans per carrier. For small group, there's no standardized plans. However, Access Health CT does require that small group plans include certain parameters, such as the inclusion of both in and out of network coverage and pediatric dental and vision EHB coverage. To offer plans through the exchange, a carrier must offer a minimum of 5 plans, and they can offer up to an additional 15 optional plans, totaling a maximum of 20 plans per carrier. For the standalone dental plans on the right side of your screen, there's no difference in plan mix requirements across the markets. Access Health CT requires that each issuer submit 1 standardized plan with the option to include or exclude out-of-network benefits coverage, or they can also offer an additional 3 optional plans, totaling a maximum of 4 plans offered in each market per carrier. No issuer offers the maximum amount of health plans in either market, and there have not been any requests for adding more additional dental plans. As a result, the committee felt that the present count of permitted health and dental plans is sufficient. Therefore, the HBPQ Advisory Committee is not recommending any changes to the plan mix for either product in either market for plan year 2026. Before I move to the next slide, are there any questions? Okay. So this slide is the recommended 2026 standardized standalone dental plan design. CMS, as I mentioned earlier, provides the annual maximum out-of-pocket amount based on data that they collect and evaluate. The portion of the benefit that I'm talking about is circled in blue on the screen. It's important to note that this limitation only applies excuse me, to in-network services for the pediatric portion of the benefit, thus excluding all out-of-network benefits and any services that are related to adult benefits. Since our current standard plan has a lower out-of-pocket maximum, it's $350 and $700, we are not required to make any changes. The committee did look at the opportunity to increase the out-of-pocket maximum to match CMS's newly calculated amounts of $450 for one covered child and $900 for two or more covered children. And issuers were asked to provide the impact to the consumer's monthly premium rate should the committee decide to increase that maximum out-of-pocket for plan year 2026. The potential change had no material impact to premium savings. Therefore, the HBBQ Advisory Committee agreed to leave the plan as is and make no changes for plan year 2026. It's my understanding that we're going to hold off on voting until the very end. So at this point, is there any questions with the information that I have provided or presented at this time? Okay, if not, then what I'm going to do is I'm going to hand it over to Julie Andrews from Wakely Consulting. Thank you.
Thank you, Kelly. And I think in the interest of time, I'll go ahead and jump to slide 15 with the two tables of AV ranges. And if time is permitting, we can come back and look at some of the regulatory changes and things that updated. So here we can see this is the table of the allowable actuarial value ranges by regulation, and the 2025 plans AV ranges are shown on the second row of each of these tables. And in the third row, labeled 2026 AV result, is where we tested the current 2025 plans under the new finalized 2026 actuarial value calculator. And you can see in the top box where we have our top table where we have our gold, silver, bronze, and bronze HSA plans. The silver and the bronze plans, which are in red font, are outside of the allowable ranges, requiring us to make changes to the 2025 plans to meet 2026 guidelines. Likewise, on the bottom table, which is the current cost sharing reduction or CSR variations to the silver plans for individuals at specific target federal poverty levels. All of these plans, current 2025 plans, require adjustments to be compliant in 2026. So if we go ahead and yes. So there are several plan features where we specify cost sharing, but are not part of the actuarial value calculator. And so they will not be listed on the slides as we review the plans. But just to make sure that you are aware that there are some other services where cost sharing is defined, but doesn't actually impact the actuarial value calculator. Likewise, on the next slide, as we present the plans, there just are a few things just to keep in mind, such things as we're going to be looking at in-network cost sharing only. The deductible and maximum out-of-pockets presented are for individuals, and family limits are 2 times the individual limits, with the cost sharing at the family level embedded. And always preventive services are currently covered with no cost sharing for consumers. So let's go ahead and jump into the gold plan. We looked at several different variations for the committee to look at aligning some of the changes we were making on other metals. In the end, after all of those reviews, the committee did think that since the current plan for 2025 is compliant, that they recommended not to make any changes to this plan for the 2026 plan year. And so that current plan is in the blue box. Does anybody have any questions about any of the options tested, or shall we move on to the silver plan?
Good.
All right, well, I'm hearing nothing. Let's go ahead and look at the silver plan. This plan did require that we need to make changes. We looked at several different levers in the looking at changes to the maximum out of pocket, the primary care copay, increasing that from $40 to $45, as well as making adjustments to the drug copays, increasing the preferred brand drug copay from $45 to $50, and the non-preferred brand copay from $70 to $75. And that brought the plan into compliance. And, you know, after reviewing all of the changes, it was felt that option 4 was the recommended plan, maintaining a lower out-of-pocket cost for generic drugs for individuals over option 5. The next plan is looking at the cost sharing variations. And the key to understanding these is that the cost sharing variations for each variation has to be less than or equal to the standard silver plan. So the selection of the silver plan at option 4 sort of ties into what is allowable and what is selected for the 73% CSR plan. So similarly to the silver plan, we made changes, recommended changes to the out-of-pocket maximum, increasing that slightly to $7,675, making the same primary care copay change, increasing it to $45, as well as making the same preferred brand and non-preferred brand drug copay changes, increasing them each $5. And so leaving us with option 4 as the recommendation. For the next plan, the 87% plan, cost sharing reduction variation, we had to look at several different levels. The allowable range is a tight, 87 to 88% plan, and we worked very hard with all of the plans to come to option 8, which was the final option, which required an increase in deductible reduction in the deductible from $475 to $415. We increased the out-of-pocket maximum to $2,950 and made some changes to the primary care and specialist care copays, going from $20 to $35 and $45 to $50, as well as touching the laboratory services copay, increasing that from $10 to $15. And then the final cost sharing reduction variation is the 94% plan. It's a very rich plan. Only small changes needed to be made, increasing the out-of-pocket maximum from $1,150 to $1,350, as well as increasing the primary care similar to what had been done on the silver plans previously. So increasing it $5 up to $15. We looked at a few plans, but ended up selecting option 2, which was the only compliant plan that met all mental health parity testing, as well as the actuarial value calculator testing done independently by all of the carriers. Moving on to the bronze non-HSA plan, we looked at several options, trying to dial into a plan, looking at different levers. In the end, we focused on option 3, which did increase the deductible from $6,550 to the $7,000, and increasing the out-of-pocket maximum from the $9,100 to $10,000, and then also using the primary care copay increase from $40 to $50, bringing that plan into compliance for all carriers. And then finally is the non-HSA or the HSA plan, apologies. So this plan was compliant as it stood the 2025 variation. And so the committee recommended no changes for 2026. As Kelly has mentioned, the IRS regulation for 2026 for high deductible health plans and HSA plans is not yet finalized and probably will not be released until April or May of this year at times. So, although this plan is in compliance, there is always the possibility of future revisions upon release of that regulation. So at this time, then I'll turn it back to the board for review and votes.
All right. Well, thank you, both of you. Julie, thank you again, as always, for joining us in these presentations. Any discussion on any of the plan designs that have been presented? If not, then we have a series of votes and we're doing them by metal. So I believe the first vote is on the gold plan, which, as I recall, was unchanged. But I would ask a motion to approve the current plan, the individual market gold plan as the plan for 2026 as well.
Yeah, hi, this is Grant. Motion to approve the gold plan.
Thanks, Grant.
Presented.
Thank you, Grant.
McNeil seconded.
Thanks, Tom. Any discussion? If not, Charlie Klippel, yes.
Paul Philpott,
Yes.
Kron Ritter,
Yes.
DJ Gifford, Steven Hernandez, Matthew Brockman, Thomas McNeil,
Yes.
Dina Berlin,
Yes.
thank you. Andrea Barton Reeves,
Yes.
thank you. Kathleen Holt,
Yes.
thank you. And Zani Matovsky.
Yes.
Thank you.
Thank you. Second vote is we're going to do the silver plans as a group. So I'll read the vote and then if there's any discussion, fine. If not, we'll vote on it. But I am requesting a motion to approve the silver plan option number 4. These are all as presented just a moment ago by Julie. Silver plan 73% plan option 4, silver 87% option 8. And the silver 94% plan option 2 as the 73, 87, and 94 percent plans for the calendar year 2026. Any discussion about those changes? If not, then I'd ask the motion to approve all 3 designs. And
Yes, hi, this is Grant. Motion to approve all 4 designs. And,
I'm sorry, all 4 designs. Math isn't so good. We need Julie. Thank
Let
you.
me say that the committee worked very hard. As you can see, we went to 8 options before we got to one of the designs.
Yes, you
So-
did. That's very good. Could I have a second?
Tom McNeil seconded.
Thank you, Tom. Any further discussion? If not, Charlie Klippel, yes.
Paul Philpott,
Yes.
Kron Ritter,
Yes.
DJ Gifford, Steven Hernandez, Matthew Brockman, Thomas McNeil,
Yes.
Dina Berlin,
Yes.
Andrea Barton Reeves,
Yes.
Kathleen Holt,
Yes.
and Zani Matovsky.
Yes.
Thank you.
Thanks very much. Our next vote is on the standard bronze non-HSA plan. And I would request a motion to approve option 3, again, as presented by Julie a moment ago on as the standard bronze non-HSA plan for plan year 2026.
Yeah. Hi, this is Grant. Motion to approve the bronze plan.
Thanks, Grant.
As presented.
Tom McNeil seconded.
Thanks, Tom. Any discussion? If not, then Charlie Klippel, yes.
Paul Philpott,
Yes.
Kron Ritter,
Yes.
DJ Gifford, Steven Hernandez, Matthew Brockman, Thomas McNeil,
Yes.
Dina Berlin. Thank you. Andrea Barton Reeves,
Yes.
Kathleen Holt,
Yes.
and Zani Matovsky.
Yes.
Thank you.
The next one is the standard bronze HSA plan. Susan, I have a question for you on this one. As we learned, the IRS rules aren't out yet. The IRS rules around these are typically just numeric, right? They may say this is your
Yes.
maximum deductible, this is the maximum. I wonder if we could approve this and also give the committee the authority, subject to just reporting to us, to make any change necessary to bring us into compliance when that rule comes out sometime in the summer.
Yes, thank you, Mr. Chair. We can do that, and I think we have done that in some past years. It usually comes out in April-ish or late April, and generally they don't make a change that has an impact, but we can do that. We can include that in the vote. It would be minor if it was anything slightly over, and then we would, to your point, report back to the board.
So let's do that. Thank you. I appreciate that. Let's do that. So
Thank
the
you.
motion I'm going to ask for is to approve the current 2025 standard HSA bronze plan as presented by Wakely as the 2026 plan, with the additional caveat that if the regulations governing HSA plans for 2026 require a change in the plan to come into compliance with those rules, that the committee will use its discretion to modify the proposal and report that modification back to us as the board. Does that make sense to everyone? And if it does, I'd ask for a motion to approve that
Yes,
that vote.
certainly. Again, this is Grant. A motion to approve that as amended. That motion
Thanks,
is
Grant. I appreciate it. Second?
Second.
Thank you, whoever that was. And,
was Andrews.
oh, sorry, thank you.
Yeah.
Any discussion? If not, Charlie Klippel, yes.
Thank you. Paul Philpott,
Yes.
Grant Rader,
Yes.
Deidre Gifford, Steve Hernandez, Matthew Brockman, Thomas McNeil,
Yes.
Dina Berlin,
Yes.
Andrea Barton Reeves,
Yes.
Kathleen Holt,
Yes.
and Zani Matovsky.
Yes.
Thank you.
Thank you all very much. And then the final vote is on the dental plan. So I would ask a motion to approve the current 2025 standard standalone dental plan as presented to us as the standard dental plan for 2026.
Yes. Hi, this is,
Thank you, Grant.
yes, motion
second.
to approve.
Thank you very much. Second?
Was it Mr. McNeil?
Yeah, thanks, Tom.
Yes.
Thank you.
Any discussion? If not, then Charlie Klippel, yes.
Thank you. Paul Philpott,
Yes.
Grant Rader,
Yes.
Deidre Gifford, Steve Hernandez, Matthew Brockman, Thomas McNeil,
Yes.
Dina Berlin,
Yes.
Andrea Barton Reeves.
Yes.
Thank you. Kathleen Holt.
Yes.
Thank you. And Zani Matovsky.
Yes.
Thank you.
Thanks, you all, and a special thanks to this committee. As Grant said, they considered a lot of options to get here. This committee works very hard for us, so I appreciate all the efforts there. Thank you all very much. With that, is there any other matter that we should discuss or bring up? James, I'll give you a final word if you'd like.
Thank you, Mr. Chairman. Just a quick heads up. We are completing the fiscal year 26 budget, which will be presented to the finance chair shortly, and then the finance committee meets in April, and then we come to the board in April for their review and approval But first, the Finance Committee has to approve it first. So it just give you a heads up, we are working diligently on the next fiscal year's budget, and we are very close. And I'm very thankful to Holly and her team for preparing that, and also my entire leadership team for putting together a very responsible budget. So it'll come to the board next month. Thank you.
Thank you. Any further discussion? If not, I would ask for a motion to adjourn this meeting.
Yeah, hi, this is Grant. Motion to adjourn.
Thanks, Grant. Second?
Seconds, Commissioner Reed.
Second.
Oh, a lot of seconds. All right, so I'll let Martian sort that out.
Commissioner
Seeing
Reeves.
no discussion, Charlotte Klippel, yes.
Thank you. Paul Philpott,
Yes.
Grant Ritter,
Yes.
Deidre Gifford, Stephen Hernandez, Matthew Brockman, Thomas McNeil,
Yes.
Dina Berlin,
Yes.
Andrea Barton Reeves,
Yes.
Kathleen Holt,
Yes.
and Zanny Matowski.
Yes.
Thank you.
Thanks, everyone. 20 minutes back. Very efficient. Thank you all very much.
Thank you all. Bye-bye all.
Thank you, Charlie. Thank you, everybody.
Thank you.
Bye-bye.
Bye.